Welcome back to the assessment series. Today we're conducting a focus exam. Follow along as I present information concerning the assessment of scoliosis. After this presentation, you'll know what scoliosis is, who is most affected by the condition, and you will learn why and how a scoliosis examination is completed. Scoliosis is a deformity of the spine in all three planes: frontal, horizontal, and sagittal. Scoliosis may be congenital or acquired. About 80 through 90% of cases are acquired idiopathic, and therefore idiopathic scoliosis is the focus of this presentation. Idiopathic scoliosis affects newborn to adult, male and female. However, more females present with scoliosis at birth, and females are affected more frequently than boys as age increases. In a study of 10 through 16-year-olds, 89% of those with positive assessment criteria were girls. Most cases of idiopathic scoliosis have onset during adolescence, from puberty to 18. Researchers report that the area most frequently affected is the lumbar area of the spine. Since the onset of most cases of idiopathic scoliosis are during adolescence, it is best to conduct a scoliosis assessment during the time frame. The exam may be completed annually or every several years. Requirements vary from state to state. Some states do not require the exam to be completed at any time. Assessments teams and/or school nurses complete the exam in the school setting. In addition, the exam may be performed in the primary care physician setting during an annual physical. Adolescents seldom complain of pain, and often the first presentation to the orthopedist follows a referral from the primary care physician or a school screening program. Scoliosis, when discovered and treated early, is more likely to have a successful outcome than when found later in its course. In addition, when detected early, treatment requirements may be more conservative and less costly than if detected later. Therefore, a scoliosis assessment may decrease the negative impact to the individual and society. The major drawback to the scoliosis exam arises from the adolescent's feeling of embarrassment and self-consciousness when being assessed without a shirt. Other drawbacks may include time missed from class and the cost to conduct the exam. Another concern includes false positive assessments that lead to unnecessary referrals to primary care physicians or orthopedists. Follow along as I instruct how to complete a scoliosis assessment. Let's start by learning the requirements. Room that locks with no windows, or windows with functional blinds. Scoliometer, tape, good lighting, and an observer. Colorful dot on each wall for focus point. Coat rack or place to store shirt or other clothing. Prior to exam date, provide scoliosis assessment information. Explain procedure. Make sure student is comfortable. Ask if the girls are wearing a bra. If not, provide one. Ask students to arrange hair off back and shoulders. Provide hair elastic if needed. Ask student to remove shirt. To start, ask student to stand on tape facing you.
All right, stand with your feet on the tape facing me and relax with your hands at your side and look at the colorful dot behind me. Okay, slowly clap your hands outstretched in front of you. Now lean forward like you're going to touch your toes. Your torso should be parallel to the floor. Now, this is known as the forward bending test. Relax and just hang there like a rag doll. Okay, stand up and turn clockwise 90 degrees to face the wall and look at the dot. All right, let's do it again. Relax with your hands at your side and be patient as I look. Slowly clap your hands in front of you. Lean forward like you're going to touch your toes. Relax like a rag doll. All right, stand up. Very good. And turn clockwise 90 degrees to face the wall. Look at the dot. All right, the procedure is the same, but a little more time may be needed for observing the back from this angle, so be patient. Relax with your hands at your side. The evaluator assesses for symmetry of shoulders, scapula, space between the arm and the waist, the lumbar humps and hips, and observes for misalignment of the spine. Slowly clap with your hands in front of you. Lean forward like you're going to touch your toes. Relax like a rag doll. Stand up. Turn clockwise 90 degrees to face the wall and look at the dot. Relax with your hands at your side. Slowly clap with your hands in front of you. Lean forward like you're going to touch your toes. Relax and hang like a rag doll. Stand up and turn clockwise 90 degrees to face the wall. And we're finished.
If any asymmetry or unusual curvature of the spine is observed in any position, use a scoliometer to measure the degree of difference in the two sides. Measure all the way up the spine. This is known as the angle of trunk rotation. A measure of over 7% requires a report. The assessment is given to the school with a recommendation for a referral to the primary care physician. In many cases, the child may only require careful observation. In other cases, the child may require bracing. Document the unexpected findings. Take a few minutes to see what you remember. Feel free to review the material as necessary. I hope this presentation offered some insight into the importance of the scoliosis assessment, as well as some useful skills.
And turn clockwise 90 degrees to face